Right, good afternoon, everyone. Right, for those who are attending and those who are about to join in, I want to introduce two very important people, a lot more important than I'm ever going to be in my life. But we've got Eitan Brizman, who's the Vice Dean of International Studies at the Charles University First Faculty of Medicine. And we've got Taranpreet. Taranpreet is a fifth-year student who obviously I've been working with for quite some time now, since we met a number of years ago, who's approaching the end of her degree at Charles University First Faculty in Prague. We've got quite a lot of people signed up for this today. This is being recorded and it will go on YouTube later. So at different points, I'll signpost to certain things which will appear in the description of the video when it goes live on YouTube. But until then, what we're going to do is myself, Eitan and Taranpreet are going to kind of have a basic conversation so you guys can get a grip on Charles University First Faculty and exactly how the application system works, how the acceptance system works, and then how the study and education system works as well. And that's where Taranpreet is going to be pure gold to everyone who's listening today. And then finally, what we're going to do is we're going to give you guys who are attending the chance to ask some questions. And there's two ways you're going to be able to do that. And I'd like you to kind of stick to these two. There are more than two ways, but if we can try and stick to the two ways, that would be advisable. One is you can actually raise your hand, and in time, what we'll do is allow you then to ask the question verbally so we can all hear it and then answer as a group or individually based on who's going to be best placed to answer your question. Bear in mind that we are recording, so any question you do ask will obviously be audible to those people who watch this recording afterwards. Finally, sorry, I had a call coming through then. Finally, the last thing to do will be that we will have a Q&A feature, okay? So let me just get back to that call. I'll just let them know I can call them later. This is medical education for you. It's always go. Then finally, what we'll then do is there's also the Q&A feature as well, which is at the bottom. So that is activated. So if you type a question into there, perhaps when it's going, when the webinars go, we can get to that at the end when it's time for Q&A. So I think what I wanted to open up is obviously 2020 was a particularly interesting year in terms of going through the application selection process, wasn't it, Eitan? You're on mute, Eitan.
Sorry, I muted myself for a while. It was a very interesting year. There was a lot of difference because of the global pandemic that's going on, forcing us from where we used to like to do everything in person to an online format. It actually proved quite successful. So we're looking at integrating at least parts of that for how we continue in the future. But we don't want to lose the in-person aspect of it. I mean, medicine is all about human interaction. So I think it's important that we meet all our students or potential students in person.
Now, for those of you that have just heard Eitan speak for the first time, you may be interested. It's clear Eitan is not Czech, but Eitan himself actually was one of the very first British students to qualify from the English parallel at Charles University in Prague. Then Eitan came back to the UK after qualifying as a doctor and eventually trained as a dentist at King's College London, and then was a maxillofacial surgeon in the UK before he decided to go and take up residency back in the beautiful city that is Prague. So for those who are a bit confused, we are talking about a Czech university with a British vice dean, which I think for Taranpreet is actually quite an interesting thing for you to see, isn't it, as a British student in Prague?
Yeah, it's been really interesting to have now a vice dean who has experience in other healthcare systems as well, because Dr. Brizman's bringing a lot of the kind of different aspects from the UK here, which is really nice.
Okay, brilliant.
Just to quantify a little bit of that, thanks, Taranpreet. I worked in the UK as a consultant in head, neck and face surgery and a teacher at various medical schools in the UK, including a teaching examiner at UCL Medical School. So with that experience, I'm bringing it back now to Prague, to my alma mater, to help implement these changes for us.
We're not many more better cities to live, to be honest, in the world than Prague, really.
Beautiful city.
Yeah. Okay. So I know we've talked a little bit about how the online system for 2020, in terms of doing the entrance exams, which we did get there and we did do very successfully. Taranpreet, from your perspective, I know because of the pandemic, a lot of the teaching has had to go online, especially during the original outbreak, and then again subsequently with the second wave that we're facing across Europe. How has that actually been? How effective has that been in kind of your continuity of education at Charles First Faculty?
So the two waves of the pandemic have been handled quite differently, because obviously now we had some prep time. So in the spring, it was a case of all lectures got moved online, and then they would email us with kind of sign up practical slots. Yeah. Because obviously some people had gone home and some people were isolating and nobody really knew what they were doing. So it was a case of everything online was mandatory, and then as many practical slots as you could attend, you would go to. Mm-hmm. Now we have a more structured timetable. So all of our kind of lectures, seminars, discussion-based classes are entirely online. And then in clinical years, when we have to go and see patients, do physical exam, perform clinical skills, those are in person. So for example, right now I have Mondays and Tuesdays entirely online. And then Wednesday, Thursday, we're split into smaller groups into time slots to attend the hospital for various practical rotations. And then Fridays are either online, in person, workshop based, depending on which group you're in.
Yeah, I think that's a good thing to hear, because obviously we're trying to adapt to this new normal for this year at least. And obviously the university has, like most universities, even in the UK, US have had to initially react to a situation that was kind of presented to them, but they've had time to kind of learn the ways of doing things in a more effective way. That's going to maintain everyone's continuity of learning, but also then to ensure everyone is as safe as possible in the hopefully the closing stages of this pandemic before we move on into 2021. So 2021, we do have some plans, Eitan, don't we? We are already scheduled our examinations, and we have entrance exams booked in for the UK, Hong Kong, New York, as well as those that take place in the Czech Republic. Eitan, if you can just tell us a little bit about, and not so much tell me, but tell those who are attending and those people who are watching the recording, a little bit about the assessment strategy to ensure that students get a place at the First Faculty. What is that really there designed to do, and how is it assessed? And how would you advise students to approach the exam, perhaps in the weeks, months before they actually go on and sit that entrance exam?
So we accept students from all over the world, and we have about 190 students in our first year, combined medicine and dentistry, coming from literally every corner of the globe. So to be able to start with their education at a similar level, we need to make sure that the incoming students are at approximately the same level. Now, we all know that written-based exams and exam formats are not necessarily the best indicator of someone's intelligence, someone's ability to study, or ability to be a doctor. And one of the beauties of the studies here in this country, in this faculty, is that the exams themselves, as I'm sure Tampere will tell you later on, they all culminate with an oral exam, a viva exam. And this is a vital part of medical education, because in my 16 years of medical practice, I've never had a patient come to me and say, Dr. Brizman, could you write me an essay on my diagnosis? Or could you fill in this multiple choice paper negatively marked on what my treatment options might be? Yet every day when I have my outpatients clinics, or whenever I'm interacting with patients, every interaction I'm examined orally by these patients. Orally in front of their family, in front of the nursing staff, my medical students, my junior doctors. And I think that is a really critical point to maintain here. That the examinations that you'll receive from our university are not only training for interview skills and for interaction that way, but also for life, for your life as a doctor, day-to-day doctor. So there will be a written paper. It's a multiple choice paper. There are 3 topics: biology, chemistry, and physics. There are approximately 25 questions in each with 4 possible answers. It's positively marked. When you reach the pass mark, when you successfully get enough correct answers, you will then be invited to interview. And the interview this year, we're progressing the way that we're doing things and taking on the MMI way of doing interviews, the multiple mini interviews. This year, we're looking to start with just 3 MMIs, things I'm sure you're used to from other medical school applications. to objectively examine different aspects of you as a person, to make sure that you are the characters that we are looking for. We have several thousand people applying for our 150, 190 places. It's about 12 applicants per place. So it's highly competitive, and we are one of the top 1% of medical schools globally. Our results speak for themselves, our prestige speaks for itself. We're one of the oldest medical schools in the world. So we must make sure that we're choosing the right people to carry our name, wonderful people like Townbury, to carry our name forward, to be successful doctors, dentists, researchers, or anything else.
Yeah. I do get a lot of questions about the exam. There's that fear factor about the exam. What I will say, I know everyone's now suddenly jumped at the word physics, which seems to kind of make everyone panic. What I've done, and I've obviously haven't seen the physics papers, is it's not like pure physics. We're not expecting Albert Einstein or Stephen Hawking to actually, you know, sit down and do these papers. It seems to be a very much blend of applied mathematics into physical principles as well. And I've had many, many students who don't take physics at the IB or at A level or an AP if they're coming from the US system, who do actually simply do their own preparation and find the physics paper very manageable. I would say that we do have an online program called Check Test Prep, which is free of charge for our applicants as well, which isn't going to replace education. It helps just focus what you've already learned and perhaps patches in some gaps from your curriculum that you've taken, which all of our students do get access to. I've obviously sat through students with the interview as well. And again, I've actually seen how students who perhaps are just passing the entrance exam excel at interview. So it is better. I do definitely agree with you that having that blended approach, more holistic approach to ensure that the right students get through that program, through that exam into the program is definitely the right way. I do understand that obviously you do have so many applicants, and we see that on our exams in predominantly London and Hong Kong over the past years. But I've noticed that the exams in London, especially Hong Kong, in previous years have a much higher passing rate than perhaps the international average.
It's interesting because I mean, the written paper is based on the A-level system as our kind of gold standard of level of education. So the written paper, I agree with you 100%. Physics is applied mathematics. It's just practical mathematics. I implore you to do some preparation, to do some practice tests as much as you can. I think the course that Ben offers is first class. And the results that Ben gets speak for themselves. That's why he does get such a high success rate compared to our students from elsewhere in the world. The written paper is simply to get that bar, to say that if you can pass that, then you have the ability to study for the exams and for the pure learning part of medicine. And the interview is to see whether you have the personality for it, whether you have the right approach, the right understanding of morals, of ethics, situational judgment, whether you have genuine interest. We want people who are interested not just in medicine, dentistry, but also in our faculty, in really giving to us. So you can expect the standard questions you're going to get in any interview about why should we pick you? What is it that you're going to bring to us? I mean, to give an example with Taranpreet here, the things she's done in her extracurricular work are phenomenal, including massive help with setting up with our alumni and organizing all sorts of things. We have an international job fair, undergraduate job fair, to give all our medical students and dentists. In fact, the past 3 years, all of our dental students have had jobs before they've actually completed their studies. And a number of our medical students, we have far greater numbers of medical students than dental students, but the medical students, a large proportion of them have jobs already organized before they actually complete their studies. That's all thanks to help from people like Taranpreet and some of our colleagues who invest themselves back into the university.
I think you have a number of UK hospitals that come to that jobs fair every year, don't you? And that's only ever increasing.
So from the dental aspect, we have some of the largest dental conglomerates in the UK, like My Dentist, Roderick's, Dental Partners, some of these huge companies. And likewise for medicine, we have huge hospitals. Swindon take 20-something doctors every year. They also do electives, rotations during the year where our students can go to the Great Western and work there. I think Plymouth is another one. We have also students to come with me to the Royal Free in London. We have up north as well a couple. We've got affiliations, or we're building further with in America, with some American university hospitals. We have in Israel, we have in Greece, we have in a variety of countries around the world. My dream, what I aim to do, is to mold you into being the best possible doctor or dentist that you can be. And that means fitting you into the market, the area, the healthcare system that you're going to be working in the future, which is why we and I actively encourage our students to go abroad, to do electives abroad, rotations abroad. I think, Tamara, you've done quite a few, haven't you?
Yeah, I plan to do at least 2 electives every summer in the UK, which is fun, but a lot sometimes.
I think it's very important to do these electives abroad, to actually experience firsthand different healthcare systems, and ideally the healthcare system that you're going to be working in. Medicine is the same the world over, the diseases are the same the world over, but there are many different ways in how something can be done. And I think it's a great advantage to experience lots of different variations, to then choose which ones are good, which ones are bad, or choose some good things, some bad things from each one, so that you yourself make the decision on how you want to practice, how you think should be the best way of doing something.
Fantastic. I just want to move on, because there's a couple of points I want to mention there, because for those listening to this now, there's a huge amount of opportunities at the university and a lot of things that the faculty have done to support students. Now, a lot of students, when I go around the world, and I do travel all around the world talking about the faculty, ask me, well, this is going to be expensive. Medicine is expensive. I think for international students, and from next year, including a European Union national, unless rules change, it's going to be around about £40,000 a year to study medicine as an international student in the UK. The current fees for next year at Charles First are £13,500 a year, about 15,000 euros, so less than 18,000 US dollars. And for the American students that are perhaps watching this is a fantastic opportunity, because in Charles University First faculty is one of only 2 faculties in the Czech Republic approved for federal aid, which is a great thing. So US students who do get a place from our exams in New York can actually access the US federal loan scheme. But also it's got Medical Board of California accreditation as well for the English language program. So kind of Charles, I think, was one of the only programs in Europe which has got both of those core features, which for those students who qualify from the US is a great asset to have. Eitan, I know we've talked a little bit about licensing in different countries, and I know that from your perspective, students having a high passing rate in the US MLE exams for the United States, as well as for the upcoming medical licensing assessment exams in the UK, is going to be a critical thing. Can you tell me a little bit about what the faculty is doing as it develops to help students support their progression on those licensing exams?
Certainly. So just to reiterate what Ben was saying, we are one of the top 1% medical schools globally. We date back to 1348. We're one of the oldest medical schools in the world.
11th oldest, yeah.
11th oldest university in the world, that's right, yeah. And the oldest one in Central Europe. Yeah. We are one of few medical schools to have the US fund accreditation, and one of only 20 medical schools outside of the US to have the California accreditation. We have special relationships with certain universities and hospitals around the world. On the highest level, we have with St Andrews in Edinburgh, Scotland, Zurich and in Sydney. Then on an extremely high level with Washington State University, with Oxford and Cambridge, with Heidelberg and a few other big names. For the States, I think our USMLE results, if I remember correctly, was 93.75% last year. And the matching is similarly high. Our students generally do extremely well in USMLE, and that's why we are one of these few schools to get accredited with the California accreditation. We are in the process of a little bit changing our curriculum, the way we're teaching, to the way that, how to explain it, for recognition of the education. At the moment, for instance, any European that studies in our medical school and wants to go to, for instance, the UK, they would get automatic full registration of the GMC. And the same with the GDC, the Dental Council. Brexit means some changes. No one still knows exactly what's going on, what's going to happen. We're still eagerly waiting for Boris to let us know. But what we do know is that the UK is moving to the UK MLE, the UK Medical Licenses Exam, which is going to be very similar to the US MLE, United States.
It's going to be similar to the reading. It's going to be similar to Step 2 of the US MLE. So there'll be a kind of clinical knowledge component and a clinical skills component.
I've heard it's going to be OSCE based with some theory assessment.
Definitely, yeah.
So with that in mind, we are now also putting into our curriculum changes to make it more USMLE and UKMLE based. Yeah. Our European accreditation will still exist. So if anyone is European and wants to work in Europe, you have automatic licensing in your country. For the UK and the US, we're changing our curriculum to be more in line with the USMLE and the UKMLE curriculum to aid those students. The vast majority at the moment of our students want to go to the States, to Britain, Germany and Israel are the four main countries, a little bit in Greece and a few other countries. But those are the four main countries. We're trying to align our curriculum to best aid those students to achieve those accomplishments.
Yeah.
For instance, we are joined up with a company called Ambos, which provides very high quality online medical education, which supplements the education you get here with all sorts of clinical information, videos, both from the basics of the clinical sciences all the way through to the actual in-person clinical procedures with patients. And the practical education, as well as even up to the preclinical education, will be changing accordingly. We're bringing in far more practical education to an earlier stage. We are an old, historic, prestigious university, which would be seen in the light of Oxford and Cambridge. Historically, in fact, during the Second World War, when our students escaped the Nazi occupation of then Czechoslovakia and were taken in by Oxford University, it was one of the only times in history that Oxford University gave the degree in the name of Charles University because of that relationship. So we traditionally had, like Oxford and Cambridge, we had 3 years preclinical, 3 years clinical. That's becoming a bit more blended. We don't want to lose that entirely because the theoretical knowledge of our students is second to none. But we want to blend in more and more practical clinical education from an earlier stage and aid our students in achieving the highest grades in USMLE, UKMLE, and any other licensing exam.
That's good because it shows how the university is developing and changing as the environment out there changes as well, both the licensing systems, but also obviously medical research and medical education. I think a lot of those outputs are due to a very innovative curriculum. I think Taranpri, I think I really want to get kind of you more involved now, Reed. Just tell us a little bit, because obviously you've now been fifth year, you've gone through the preclinical, you're nearly at the end of the clinical, one more year after this, and then you'll be, on the NHS, hopefully not dealing with COVID all the time, but dealing with other things. But tell us a little bit about how the education system works for you as a student. What are the kind of things you have to, as a student, be prepared for? I think those people who are listening to this, if we've got admitted, they need to know, listen, what am I going to face as a student, a medical student, say at Charles University in Prague?
So when you first move here, the most important thing is that, yes, you should have fun for 2 weeks, but then you should start studying. The exams they're not easy. Medicine shouldn't be easy. That would be slightly concerning. But they are very rigorous. And I feel a lot of students, especially in first and second year, feel, oh, why are we learning so much theory? Because it is very heavily theory based, especially in the first and second year, because you have to understand anatomy, you have to understand physiology, you have to understand how biochemistry works. So you spend a lot of time kind of in classrooms, almost A-level style, learning, understanding concepts, going through, and then you sit your exams. I really think the way the exams work here is really good because there's normally 2 to 3 parts, a written, a practical, and an oral. So the written part tends to be an MCQ and essentially a filter. Have you studied enough, yes or no? Most people then pass the written and progress on. The practical part then really tests how much you can actually do, because the thing with medicine is it's not so much about whether you understand the disease, but do you know what to then do with it going forward? So for biochemistry, there's a review of practicals. For anatomy, you go into the cadaveric lab and you have to point things out, such and such. And then you go on to an oral exam. And the oral exam tends to be much more of a discussion than you anticipate. It's very, very intimidating in first year because you're going to go and sit in front of a complete expert in the topic, having studied it for a year, 6 months, and you don't really know what to expect. But once you sit your first one, it goes easier because you realize it's going to be a discussion. If you don't know something, quite often the professor will help you walk through the logic to get to the answer, because they really want to see whether you understand the principles, as opposed to, okay, the chlorine levels in the blood need to be X, Y, and Z. They want to know that you know why. And at the time, it does feel very irrelevant. But then when I went and did placements in hospitals, I've actually had doctors kind of come up to me and I'm looking at x-rays and this kind of like, your anatomy knowledge is really good. Like your understanding of what is happening in this x-ray is really good. And I feel you kind of don't realize how important the core subjects are until the end of third year when you start looking at pathologies, and suddenly you just understand everything because it all comes together. I think that's then really well reflected in the clinical years because you go through each kind of medical specialty. So like I've just finished oncology, I'm now going into psychiatry. So I'm pulling on knowledge from all of the years and refreshing that knowledge now with a more clinical view.
Yeah.
Which on the one hand is really good because if you studied hard in preclinical, your life in clinical is a little bit easier because you're not having to re-revise everything again, you know, and you understand it. On the other hand, those certain subjects that you studied enough to pass the exam for, it's good because it forces you to relearn them and to make sure that you understand the principles. And I think that's why, especially applying to the UK, a lot of medical students find that their theoretical knowledge is commented upon by doctors when they're on placements time and time again. Because I don't think this preclinical clinical split is as common in the UK now.
Yeah.
People are moving away from it. And I'll be honest, like second and third year, it does feel a little bit like, oh, am I really in medical school? Like I'm just looking through science and this. But as long as you keep up with doing placements and going to the hospital, you feel better and you understand a lot more. And that means that you can then apply that clinical knowledge into your exams. And you learn things in your exams. I was examined by Dr. Brizman and he taught me a really new way to deal with asphyxia in my exam. So the exams are not as terrifying as they seem. And they're actually a really good learning tool. And you understand how much you understand. And I think the only way that you can prepare for that, especially in first year, is just by discussing the exam questions with your friends. Because I studied in the UK and oral exams are not really a thing. So it's a very different type of memory recall. And you almost need to practice the memory recall skills as well as the actual content, because we're not used to, when you write an essay answer, you write an essay answer, that's the end of it. You're not really expecting a follow-up question, which you do get in a discussion. And it's really good because it pushes you and it makes sure that you understand what you're talking about. You have not just memorized a big long list.
Yeah, it definitely also allows you to progress into depth. So you can start off at a superficial level and you can go and it's a bit like playing Tetris. At some point you'll fail because what they've done is the tutors, if they're a skills examiner, which I know at first faculty they all are, is they will take you from that superficial level and take you on a journey until you can't know anymore, which is great because it really shows you how deep your knowledge is. And if there are areas that you need to then progress onto afterwards, at least that's where your starting point is. And it's also great because I think you don't just have one exam at the end, you have credit exams while you go through certain modules. Tell us a little bit more about those, please, Tara and Pete. And soon I'm going to open up to everyone who's on. There's a couple of questions already which I'm going to read out, but to talk a little bit more first about those credit exams, if that's okay.
So credit exams are a slightly foreign concept if you've come from the UK, but if you think about it in terms of module exams, it makes slightly more sense. So for example, in first year, as you're going through anatomy, you have your anatomy final at the end of the year in June, but every kind of 2 weeks or so, you'll have a credit testing class, which is essentially a slide test on whatever the last topic that you did was. So you'll get 10 images of anatomical diagrams, label this, what's that, what's this, what's the innovation for this? And it's really good because you have multiple chances to take these tests and you do not have to pass every single one. I think you have to pass, you're allowed to fail 2 or something like that. And it keeps you on top of your studies, because you have to study the last 2 weeks content for the text this week. So it means that you don't come to May and realize that actually there's half the subject you have missed because you didn't come to class or weren't paying attention or were busy with something else. It really forces you to kind of keep up with the education. And it's also really good because it shows you what the examiners want. So something we realized about halfway through the year is, hang on a minute, half of the images from every single slide test we're sitting are from this one textbook. Maybe we should go and look at that textbook. And then we realized all of the follow-up questions we're getting asked in the exam are from that textbook. So it's good because it's almost a two-way.
The wrote the textbook.
No, surprisingly not. It's really good because it's two-way information. You know, the teacher knows that you are studying and you understand what's going on. And we did have cases where there was one exam where the entire class failed. And the teacher kind of said, okay, maybe we should go back to that topic. And we got to all go through it and revise it kind of in real time, as opposed to getting to the end of semester and realizing nobody understood this topic. Okay. But it's also really good because you begin to understand what the teacher wants. And that's really useful.
Eitan, go ahead.
There's a very key difference that Tampere is pointing out. I've been fortunate, as Ben explained earlier, to experience UK university education at King's College in London, where I studied dentistry, and medical education here in Czech Republic, where I studied medicine. I must say, you know, I studied dentistry at King's afterwards, and King's is fantastic. But I really missed the way things were taught here. And I really appreciated that point when I was a student at King's, how great the education is here. There is a modern, the last decade or so, trend in moving towards this problem-based learning, which is now actually that trend is turning away again. Problem-based learning, I don't particularly agree with, not in medicine, because in PBL, it's stepwise medicine, is the way I look at it. And you know, if you've got this, then you do that, then you do that, then followed by that, and then wow, everything's hunky-dory. But life doesn't work that way. And the bacteria of the infection, or the virus of the infection, they don't read the book about them. They don't read their chapter or the paragraph about them. So by teaching in the manner that we teach here at Charles University, we're training you to give you this broad knowledge that whatever the problem might be, you will have the resources to deal with it. And if you don't, rather than the spoon-fed manner of education that the UK system uses, we teach you how to find the information. We teach you so you will be sorted for the rest of your life, the rest of your career, for everything, in whatever you decide to do, because you then have the knowledge of how to find that information, how to work problems out. I think that's really, really vital for it.
Definitely.
Right. I think, just one thing I'd like to add to that. Oh, sorry.
Go ahead,
the thing about PBL learning is, I completely agree, Dr. Brizman, it doesn't work from the beginning, but I think, especially in fifth year, and I've heard from 6 years, a lot of our classes kind of transcend into then a PBL discussion. But I feel it's really useful at that point because we have the knowledge to be able to have the discussion and understand it. So especially like in oncology, some of our classes weren't didactically taught. It was more a case of, okay, so you know that this particular channel gate doesn't work. What would the symptoms be? What would the pharmacology be? Why would you do that? And I think that's really important because it's such an important way of thinking when you're a doctor.
Yeah, I think you have to understand the anatomy and physiology before you actually start to look at the pathology of a problem. You need to understand the normal before you look at the abnormal. I know that's a particular strength of the Czech system, actually. And that's when back in 2015, I had a conversation with the surgeon who led the USA's first full face transplant. I was in his office in Boston, Massachusetts. That's Professor Bojan Pomahac, who graduated not from Charles, but from another university about 2 hours away, from Pulaski University in Olomouc. And that was the one strength he said when he went to the US. Although clinically the American trained doctors were more up to date with how things work clinically in the hospital environment, which is very different obviously in the States, his level of knowledge of the pure sciences, the anatomy, physiology, and then pathology, which helped him through the USMLE steps, was far in excess of what students who'd gone through the US system had in place. And I think I agree with yourself, and I agree with Taran, having taught students before, it's very difficult if you haven't got a certain baseline pure knowledge to construct something which is a lot more what they call synthesis or evaluation if you haven't got that pure underpinning knowledge there, rather than on a piece of paper or on an iPad or a phone, which you're not going to have in a theatre, to be honest, a lot of the time. So I do want to move on. Now, there's a couple of questions that I do want to just deal with very quickly, because these are quick questions that someone, anonymous attendee, has asked. One is, what language are students taught in? Are they taught in English? Yes. We're talking about English language programs here. For those that haven't looked at this before, Charles University, although in the Czech Republic, has 2 medical programs, one taught for the local students in Czech and one for the international students taught in English. Hence, they're called parallels. They're identical apart from the language they're taught in. So you don't have to worry about the language of tuition at all. Everything's in English. All the programs on the Medical Doorway website are all taught in English. And I think I'll feed on, I'll actually ask you both about this, because this is an interesting question. Do you have to know Czech fluently when you're on placement during the clinical years? Because obviously you are taught how to speak Czech in class. You know, you have Czech lessons in the first 2 years. I think most of your Czech lessons do come from outside of the classroom, in the restaurant bars, etc., and the other things that your students get up to when they're living in a vibrant city that is Prague. But can you both, I think Taranpreet has a more recent experience, and Eitan, I know you're a fluent Czech speaker. What level of fluency do you find you have, and how does that help you in the clinical setting?
So I think the thing with Czech is the more you engage with it, the easier it is. I'll be honest, in first year, I attended classes, did the bare minimum, passed the tests and moved on. But as you kind of stop surviving and start living in the city, you realize, actually, I want to go skiing, and this is a lot easier if I can speak Czech. And, you know, Google Translate exists, Duolingo exists. Yeah. So in the beginning, you 100% and fully walk around with Google Translate on your phone, translating everything. But once you've translated the same statement about 5 times, it kind of gets lodged somewhere in your memory. So you assimilate Czech as opposed to you learn Czech, if that makes sense.
Duolingo is fantastic. I'm learning Russian on Duolingo.
Duolingo is great. Yeah. So you do have medical Czech classes, which are really useful. And from second year onwards, you go and take patient history for no other reason than taking the patient history. You probably don't really understand in second year 90% of what the history is, but you're just surrounding yourself by Czech words and Czech medical words. So the more, and then you're doing Duolingo, you're living in the city, you need to, you know, go to the store, go like to the cash machine and do all of these random things. So you pick up words. So I would not say I am fluent in Czech at all. I can order a drink. I can go to a restaurant in decidedly very poor Czech with a terrible accent, but it is understandable. But I actually have found that my medical Czech is much better. I'm much more able to converse with nurses and talk to patients in that manner, in a more formal language with a certain kind of its own diction. But I really could not chat somebody up in Czech. Okay. Because I haven't personally needed to do that yet.
Yeah. You've been too dedicated to your studies, Taranpreet. I know Eitan.
Definitely.
I know Taranpreet's in a city where now everyone also speaks English. Yeah. It was probably different, Eitan, when you went to study in Prague. Yeah?
So when I came here, just turned 18. I didn't have my Movember in those days. I probably had a bit more hair as well. I didn't speak any Czech. I chose to study here because of the experience I can get from it, because medicine is medicine the world over. And your chance at university is your chance to really, when you live somewhere, you really experience another way of life, another culture, another language. Czech itself, Czechia as it's called now this week, is a population of 10.7 million people. But it's a Slavic language, which is Latin-based. So and it's also it's phonetic. So what you see and what you read is how it sounds. When I first started working as a doctor in the UK upon graduation from here, I found Czech to be amazingly useful in my house jobs, in my it's now called foundation year jobs as a doctor. The number of other Slavic language patients, so from Poland, from Slovakia, from Slovenia, from even bits of Russian, I could understand spoken Russian to communicate with patients. The ability to know Czech enabled me to communicate far better with all these patients. Yeah. And when you're unwell, the last thing you want to do is to be battling to be understood by your doctor of what the problem is and where it's going. Part of the reason for coming here is to experience the wonderful history and culture of Bohemia, of Czech Republic, Czechia. It's amazing people, amazing history. Ben, you're right, English is ubiquitous, especially in Prague or in Czech Republic now. Everyone speaks it, everyone understands it. But one of the benefits, one of the reasons for coming here is to experience a new culture, a new language. We do teach, in the first 3 years, we teach medical Czech and getting around town Czech. I think there's an intensive course as well on that during the studies here. And there's also modules you can do, but I think the best way of learning a language is making friends and immersing yourself.
But I know a lot of the local students want to meet the international students as well, because the local students, they have aspirations to go and work in Canada, the US, Australia, etc., and they're looking to improve their English. So I advise my students to go for 2 coffees a few times a week. The first coffee is a Czech coffee. The second coffee is an English coffee. The only difference between the coffees is the language spoken. I would have to say, however, the coffee is significantly better in Prague than it is in the UK.
Dr. Brizman normally suggests something similar with beers, which I find works quite well.
My Czech gets better after a few beers in Prague, definitely. What I would say is, but to close that point down, I know I spoke small amounts of Bulgarian, and I then could pick up words in Czech as well. So there's a lot of crossover with the languages in that part of Europe. So like I said, I definitely agree with Professor Brizman that it definitely helps when you're speaking with people who are perhaps Polish or Czech or Slovak citizens or Bulgarian or even Russian or Belarusian. Right.
Just confirm one thing, that all the lessons here are taught in English.
Yes, correct.
All the interaction is in English. To speak with patients, we do have English-speaking patients. In dentistry, we specifically try and get a lot of the English-speaking, the expats that are here. In medicine, we can't just choose native English-speaking patients to be unwell in hospital. So I strongly advise learning as much Czech as you can to be able to speak with patients in their own language. But there's always a doctor or someone else around to help translate. But I don't think you should use that excuse to not learn the language. I didn't speak a word of Czech when I came here. And I had a few beers to help me learn my way.
I'm going to move on to the questions, guys, because we've got 15 minutes left, and I do want to open the floor to people who want to ask more questions. There's a few questions here that I'm going to go through one by one. They're very quick to answer by the looks of it. Someone's asked, when do applications open? We're already accepting applications now. We've already got people booked in for the exams for 2021. That even if the university systems aren't yet open, you can apply on the Medical Doorway website, get access to our learning materials, and the minute those application systems, the student record systems at the university open, then your application will go on there. And that's for all of the faculties that we deal with at Charles University, as well as other programs that we are working with as well. Someone's asked about scholarships and financial aid. You're not going to find that in the Czech Republic. The reason is these are state universities and the fee is the real fee. Unlike programs predominantly in private universities, which have a fee and then they offer some form of a moderate fee discount, the fee that is available is the fee that is charged is the real fee. So it's about 15,000 euros, I think I just calculated a year, just under.
Then we do have for financial aid, the American students have from their government. There are a couple other countries that their government provide financial aid. In the UK, if you're coming from the UK, there isn't the government help for it, as there is in the UK. There's what, £10,000, £9,800 fees in the UK. With regards to scholarships, for those top students, as in the top 1 student of each year or top 5, 10 students of each year, they do get scholarships. They do get, which are actually being increased.
Can you talk a little bit more about this? This is the students who've been admitted to the program, is it? Yeah.
So based on your grades at the end of the year.
Yeah.
And what we're doing some slight changes to that won't be just based on your grades, but what you've done for the university as well, whether it's research publications, whether it's sporting achievements, whether it's extracurricular activities that have aided the university to show your input to the university, as well as your high grades, then you can get significant fee discounts. Yeah. But only once you've proven yourself within the university.
Brilliant. Okay, that's great. Right then, someone's asked, what are the requirements for applications other than CV and entrance exam? Well, actually, we don't need a CV for many of the faculties, actually. The Czech Republic has a very, very good system where it treats everyone very equally, a complete secular system. So basically, when you apply, you are simply applying as someone who has graduated from high school or due to graduate in that academic year. And generally speaking, the kind of paperwork you need is relatively minimal. Some places ask for a personal statement, but it's not like a personal statement for the UK. For Charles University First Faculty of Medicine, simply it's a copy of your passport and then the information that we need on the medical doorway application form. Some faculties need a CV, some will need a reference letter from your school simply to state that you are in your final year of school. But apart from that, generally you do not need any paperwork. Once you've made your application, myself or a member of my team will email you requesting any documentation that we need.
And if I can, sorry, just for us, First Faculty, because of our change in the way we're doing our interviews, we may, it hasn't been confirmed yet, but we may be even this year requesting some sort of personal statement from the students beforehand, just to encompass that side of it as why we should accept you, why we should be interested in you, what have you done to prove your interest in medicine or dentistry, so on and so forth. But that's not confirmed yet. That'll be over the next month or two, I'll let you know.
I've struggled to come on to any medical applicant who hasn't got a personal statement or at least a formed personal statement ready to go. Now, someone's asked, when do we know after the entrance exams if we got accepted into the university or not? For First Faculty, you will find out, and hopefully this hasn't changed, Professor Brizman, you will actually find out on the day, and this is quite a fall off your chair moment when I do presentations, because for those people that apply, and I'm going to put some context onto this, for those people that apply to medical school in the UK, you apply by October the 15th. If you're lucky to get shortlisted, you may have your interview around February and then get your offer by the end of March. And then that offer is conditional on what grade that you get in August. And for next year, it's August the 24th, because they've all been delayed. The way it works for Charles First Faculty of Medicine is a little bit different. You apply, you walk into the exam room, you will do the exam. At that point after the exam, say an hour after the exam, once the paper is being graded, you will then be told your results and if you've been shortlisted for the interview. And after the interview, you'll be told then if you've been accepted. And actually, the offer that then is unconditional. There's one caveat to that, but it is an unconditional offer. So you could walk in the morning with no seat in medical school and walk out with a unconditional offer to study at the 11th oldest medical school in the world. Now, when I say it's unconditional, we simply have to go through a process called nostrification, where we have to submit copies of your high school diploma certificates, or in the case of A-levels results, at that time when they are published. Now, provided you don't have a catastrophic calamity on your A-levels, which if you pass the Charles First Faculty exam, you certainly won't do, we've never had that before, you will then simply go through a procedural process with paperwork, and then you'll be enrolling at the end of September. I'm assuming there's no dramatic changes for 2021, Professor Brizman?
Not significantly, no. So, as you said, the multiple choice paper will be marked immediately. If it's online, then it's an instant result. We see it straight away. The interview, which is the mirror to how it is in your exams in university here with us. So all the 100 and something exams that Tampreet's done, she knows straight away her results. What's the point in waiting? You either have the knowledge or you don't. And for the exams that by the time you get to the oral exam part of it, you've proven your knowledge in the multiple choice and the practicals and other parts. So this last confirmation of subjective examination in the oral exam is just confirming that you can and you have it. You can do it and you have it. So you will find your results straight away.
Another question about if corona pandemic continues and becomes worse, will the exams be held online? Yes, if the situation requires the exams, like in 2020, will move to an online format. We've set the exams up to run in person because it's easier to move from an in-person organised exam to an online exam rather than the other way around, which is the usual case for the university. So yes, don't worry, if the exams need to move to online, they will move to online. And we generally keep the dates the same. We may move a weekend date to a weekday date, but they won't dramatically move. Someone's asked an anonymous question, what are the entry requirements for international students? Officially, the entry requirement for the vast majority of students is that you have successfully completed high school and have the eligibility to go to university in your own country. I think there may be one or two exceptions for US students to deal with accreditation there, but what you're best doing is dropping us an email or an inquiry with your specific high school system and the country you're in, and if there is a particular requirement for your particular country, we can email you back to that. But the vast majority of students, it's simply have you successfully graduated from high school and have the eligibility to go to university in your own country. Someone says, when do the applications officially open by the universities themselves? This is assuming you don't want to apply for free with Medical Doorway, which most students tend to do.
Would strongly recommend. Made my life a lot easier.
It varies from one faculty to the other, so it does vary. But if you want to get access to check test prep to help preparing for the exams, and bear in mind, Medical Doorway, we can also book you in for the exams at the universities themselves. You don't have to do the exams in London, New York, or Hong Kong to do that. So we can even book you in for the Czech Republic in-country exams, should you wish that as well. They do differ from one place to the other. Many, it's actually not till the beginning of next year. So if you do want to make an early start on your preparation, definitely get the application on with Medical Doorway sooner rather than later. Someone says, do you accept a diploma from the Cambridge program? Now that, I'm not quite certain what you mean by that. I know certain colleges have international foundation programs which give you the eligibility to go on to university in the UK. What I would ask you, and it's anonymous attendee, so I've not got your name or email address here, but if you can just either drop an email to hello@medicaldoorway.com or pop a question which is a little bit more detailed about the Cambridge program, then I'll be able to actually answer that one more accurately for you if it's a slightly anomaly to A-levels, okay? Do students need to be studying physics, chemistry, biology, and/or maths in the final year of high school? Officially, no. We advise all students to at least have 2 sciences, because obviously on the IB, you can only study 2 sciences normally at the higher level anyway. So I definitely advise 2 of the sciences is going to give you a good foundation by which to approach the entrance exam. For the vast majority of students, their maths and physics at GCSE level provides a very good foundation by which they can build on with some additional self-study, as well as the information that we can provide as well. We do have a host of with some past paper question options, as well as the program that we've had developed by a physics tutor specifically for these programs based on the syllabus which the university provides. So I would definitely advise at least 2 sciences at the higher level or A level. If you have got a third, maths or physics, obviously it's going to be an advantage, but I wouldn't say it's mandatory, and it's not required in order to apply. That's the important thing to say.
Can I just add, sorry, about the physics and the maths? I took further maths at A level, but I dropped physics. And actually a lot of the maths and physics that was involved was mainly GCSE with some AS, and it was more about the application and thinking of how you apply it. So if you are going to study for these exams, I would definitely review physics, but think more about how the physical concepts are applicable to life and medicine. So there was a lot of stuff about like medical scanning and how you compile the images, which the actual physics is quite basic, but you need to be able to like apply the physics and the pure theory.
Brilliant. Okay.
You know, we have students of all ages. And by that nature, there's people who haven't studied biology, chemistry, physics for years, maybe even decades. And I want to get the best possible doctors. You could have studied art and whatever else, but if you're able to pass that exam in biology, chemistry, and physics, that means you must have studied, self-studied, even if you haven't done it as exams or as a school-taught topic. But then if you have that ability and that knowledge to pass the exam, that means you have the ability to continue with the harder studies that you'll be receiving of chemistry, of anatomy, of physiology, of you know, biophysics, things like that in university. So no, there's no prerequisites for which specific subjects you studied at A level, at IB, or at SATs or anything else. You have to pass our exam. Yeah,
I think one of the examiners at another university said this very well. He said he was interested in what the students knew, not what they claimed to have studied. And that was, I think, that was kind of definitely encapsulates what you've just said in one sentence, really.
So it's about the knowledge and how you can implement it.
Yes, exactly. Yes, 100%. Someone said, is the personal statement required or not? That was a little unclear. It's required for some faculty applications. If we're talking more broadly, not just Charles First faculty here, it's required for some, it's not required for others. The one thing I'll say is if Charles University First faculty do implement a required personal statement, it's not going to be analysed to the same level of detail perhaps that a UK programme does, because they don't have the entrance exams. They're going to want to see why you want to pursue medicine or dentistry. And it's not just a question of, you know, the positive experiences. Medicine, dentistry, if you watch the kind of the TV programs, can be a glamorized profession. my work in healthcare, Eitan's work in healthcare, and Tyrone Preet's, you know, it's not being covered in blood or other bodily fluids is not glamorous at anyone. It doesn't matter, and it doesn't matter how many years you've been doing that for. It's certainly not glamorous. So, and also the hours that you're going to have to work are not glamorous. There's nothing glamorous in doing a night shift. Believe me, it might look good on the news, you know, and things like that, or attractive proposition with a quiet hospital. Hospitals are never quiet at night, I can tell you. It's think about that. Why are the experiences you've had negative ones? Why after seeing those do you still want to pursue a career in medicine or dentistry? What is it about that? You know. So yes.
I would suggest.
Go on,
I would suggest that you do prepare even for us. I would always appreciate a statement as to why you want to study medicine or dentistry. What experience you have with medicine and dentistry. Have you done any background work for it? Have you done any work experience? Do you understand, as Ben's saying, do you understand really what it is to be a doctor, a dentist, or anything else? Because exactly as Ben says, there is, you know, what you see on House or Scrubs or Grey's Anatomy, there's a vast difference to that and reality. I want to know, why are you applying to us? Why should we accept you? What is it that you've got to show that will be a benefit to us as our university? Do you know who we are? Do you know where we are? Do you know anything about us? Have you engaged with our student union, our MedSoc, Medical Student Union? Have you contacted them? They're really a lovely bunch, very proactive. They've got a wonderful website. I think it's, Tam, please correct me, I think it's lf1medsoc.org. So get in contact
Published yesterday.
Get in contact with them and find out what's going on from the students there. That's what I want to see in your statement is who you are. Are you really interested in medicine? Is it you, or is it who is pushing you to do medicine? Are you going to be successful for yourself and for us, for not just in medical school, but also afterwards?
Yeah, I know. As I've had interactions with the past presidents of LF1 MedSoc. I know Rhodey from the previous year was fantastic at organising lots of things, and then there was, and the name is literally just
working in Luton.
He's working in Luton now, Rhodey.
Yeah.
He's also,
and Suhaib was at Addenbrooke's, right?
So he came to one of our open days at the Royal Society of Medicine a few years ago and spoke there. And, you know, the parents didn't want to speak to me. They didn't want to speak to the university. They went straight to him. And I think he's doing his surgical training now, isn't he? A specialist.
Yeah, he's a CT2 now in surgery.
Wow, that's amazing.
Former orthopedics.
To get straight into Addenbrooke's Hospital in Cambridge for his foundation rotations is a kind of a huge achievement for him. As also, it kind of tells you exactly how sought after graduates from Charles University First Faculty of Medicine are. Last question so far, and I'm going to ask people to ask more questions because the floor is going to be open pretty soon for that, is someone said, do you need a proficiency test in English if you're a US or UK citizen? No, you don't. It's given that if your citizenship comes from an English language speaking country that you don't. In fact, the university will be assessing your English language skills at the interview stage anyway. So, and if you can't communicate effectively in English, that is a license for the examiner to automatically say, we can't accept you if you can't communicate at the interview stage in English. But if you come from the UK or the US, that's a given that you speak English and you're not going to have any issue there, and no other requirement is needed like an IELTS, etc.
If you can understand the questions in the exam and therefore pass the exam,
you can speak English.
You can speak English, and then that's just confirmed during the interview stage. It's rare that students will get through the exam with no knowledge of English. I can remember very, very few that were then at the interview were not understanding the questions that we were asking. So, of course, at the interview, there is a final confirmation of your knowledge. But that's our proficiency test. I think that's a much more accurate.
What I would say, for those people that perhaps whose English is a second language or even a third language, do not be afraid at the interview. If perhaps the examiner's used a word that you don't understand, it could be just pronunciation, it could be accents, it may just be a phrase that is not as commonly used as a similar phrase. Just ask there, I didn't quite understand the question, do you mind repeating it? And usually the examiner, and that's a very British thing to say, you know, it's a case of the examiner will turn around and say, oh, right, okay. And they'll rephrase it in a slightly different way. Same question, just in a different way to ensure that you have actually grasped it. If after 2 or 3 attempts that you haven't grasped it, then there's a problem. Okay. So I will just say that, do not be afraid in the interview. Don't just look like a rabbit caught in the headlights. If you don't understand the question, be honest. You don't understand the question, because the one thing about being a great doctor and any health professional is saying, I don't know this, I need to find out. And that is one of the best things that you could admit to yourself, because doctors are not all powerful, dentists are not all powerful. We've all got things that we do and don't know. Okay, so do say that in the exam. Someone has come here, said, is there a possibility of not doing the entrance exam if you get high results in the IB diploma program, or is the exam compulsory? The exam is compulsory, okay, for everyone. It's an equal opportunities based system. Everyone has to take the entrance examination, regardless of what they do or don't achieve on A levels or the IB. That's quite clear. And there's no fairer system than saying everyone has to be treated the same way. That's even the case for graduates. We've got students who've got biomedical science degrees, first class degrees, students with master's degrees. They have to take the same exam as everyone else as well. And I think that's a really good thing, because as a first level, entry level doctor, unless you're going on to a graduate entry program, on a first level, you're all the same. You're all going to work as equals, and then you'll work as team members throughout your time at med school and then in the clinical environment as well. Right, I'm going to open the opportunity now for some last minute questions. We can stay online for another 10 or 15 minutes, I believe, Eitan, if that's okay for you. Yeah. If there are no other questions, then we can part and, well, I wouldn't say go our separate ways, but we'll definitely see each other again, perhaps in person at some point soon. But from anyone who's online now, and obviously we've been streaming on Facebook as well, are there any particular questions that anyone wants to ask? Because I know we've got students from East and West here. We've got students coming in from South Korea, as well as Hong Kong, as well as the Eastern US at the moment as well. So any more questions at all? Anyone?
I think that's what makes it quite interesting studying with us, is that you will get to meet students from all over the world. We're one of the largest faculties that have this international program in such large numbers, that you will meet and mingle with different cultures, different languages, different people from all over the world who will become your very, very close friends. Gives you opportunity to make friends with them and be invited back to wherever their home country is, as you can invite them back to yours. For us, fascinating experience here. Plus, you live in the metropolis of Prague, where everything and anything is possible. Things are open when there's no COVID, 24 hours, and beer is cheaper than water. So
I think
there are things to do that are not drinking related as well.
Skiing is about an hour and a half away from here. There's rock climbing. There's all sorts of wonderful activities. Actually, Taryn, what sort of things do you guys as students get up to?
So we recently learned actually that Prague is the cheapest place in Europe to learn how to ski. So actually a few of my friends went down to Spindlrove recently, and we got skiing lessons for what equated to about £10 an hour, ski hire included, which was ridiculously cheap. It's also like pre-corona times, it's really easy to travel around. So we do a lot of like weekends in Berlin, we'll go to other cities. There's a lot of like panic rooms, because Prague can be quite a touristy city, but that also means there's always some new tourist attraction for you to go and tourist in, which is quite nice.
I will mention there, Taryn, because this is something which I do speak to students about, and these are kind of more procedural things, that the Czech Republic is part of the Schengen passport-free area. Yes. So once if you're a student who does require a visa to study in Europe, and that will include Brits from next year on the current regulations, then you will basically have a visa which, although it's for your residency in the Czech Republic, you can then cross into Germany and there's no border posts. It's under normal circumstances pre-COVID-19. Basically, the borders are fully open. And I've done this myself. I have jumped on a train in Prague, and I've taken the train all the way to Berlin. It's a 4.5 hour journey to Berlin, because I had to catch a flight from Berlin. Alternatively, I've taken a bus from Brno in the south and got off in Vienna. Okay, and I've taken the train from Vienna in there with the first time you've crossed a border is the text message on your phone. That's it. So you can, so as a student who perhaps is coming from into Europe on a visa, you could literally, in theory, walk from Prague to Madrid. I wouldn't advise it. There's quicker ways to do it.
But the trains are much nicer.
Yeah.
All the planes. Yeah.
But that will give you an opportunity, because bear in mind, medicine dentistry, 6- and 5-year programs respectively. You can't just stay in Prague or even the Czech Republic for that period of time and just study. these are going to be some of the greatest years of your life, you know, where you've got more flexibility to do more things. So do go learning to ski. Do take the train to Dresden or to Berlin. You could even take the train direct from Prague to Budapest in Hungary as well, because there's a train that goes directly there from Prague. You can go and see these things in the time that you're not studying. Even a week, you can do a day trip to Vienna or a short weekend trip to Vienna as well. These are all things which are possible once you're studying there, and definitely take those opportunities. There's a couple of basic questions here, Eitan. Just want to...
If I could just very quickly, just on that note, there's also the sporting activities here, like in every major city university. We're very active, and Czechs are very active in their sports. They love their sports. From tennis through to beach volleyball. We have the beach down by the river, water sports, football, rugby, cricket teams, everything that you can imagine there is here, and the students are really actively involved.
Ice skating and ice hockey are the big things, aren't they?
Yeah. I think the other really great thing about Prague is the fact that the trains are so cheap and so regular means that you can definitely get drunk on Thursday and decide to go to Vienna on Friday, and it will cost you probably less than what you were drinking.
For those students that don't drink, I apologize for that comment in jest. But Sarah, quick question, and this is something that's really important. One thing I've noticed is it's a very student-focused city, and that they try to save you money where they can. How much a year do you pay for your student travel permit for the entire city? Please, everyone, listen to this.
So for my Metro Pass for Prague is currently £360 for 3 months. That's £12, which comes to about €15 for 3 months.
Unlimited public transport.
Yeah.
The capital city in the Czech Republic for €15 for 3 months. Yeah,
less than my daily travel passes in London.
Okay, so one underground trip in London on an Oyster card.
It's like £5.60,
isn't it?
Oh yeah, £5.60 for a
one
return.
is £2.50.
Yeah.
So basically, you are going to basically be saving. You're going to on 2 trips on the London Underground. You have basically paid for your entire month worth of travel.
Yeah.
Yeah.
So it's 3 months here costs the same as 1 day in London, which is what I worked out recently.
Christine is a counsellor who I know from my work with the international schools, who's actually recently moved from Chicago to Prague as well. She's a high school counsellor now at the international school in Prague, I believe, Christine, I think. But she's just agreed with you about how Prague is so cheap compared to even a secondary city in the US, and it is remarkably cheap. There are some things which are more expensive. There are some things which are significantly cheaper.
But also the student discounts here are really good. Like your ID card will get you upwards of 50% off any number of things. Yeah. Like we pay child fares on all of the trains. So my train actually to Vienna, it was I think a €5 train and a €4 bus back.
Yeah. I have gone across the country, and this is the problem when it is so cheap. I've gone from Prague to Olomouc across the country, 2 hours on the high-speed train in first class with food and champagne for like £14.
Yeah.
Now I would spend, I could do a standard class train trip from Staffordshire where I live to Manchester, 45 minutes, and it cost me more than that. So. Anyway, a couple of questions I want to go over here. For those 2 that I've asked, is this presentation going to be shared? Yes, it's going to be recorded. It is being recorded. It's going to go live on our YouTube channel later this evening, and I'll email everyone who is registered. We have had over 150 people registered for today's webinar. Many are listening and not asking questions, granted, but I'll make sure that this is then emailed out to everyone who registered for today. And for those who that perhaps international careers counsellors of where we're connected to over 1,000, it will come out on an email to everyone as well. Is the MD valid in Spain? Yes, because Spain is a member of the European Economic Area, as obviously is the Czech Republic. So the program is automatically recognized in Spain under European Economic Area rules. The one caveat is you will have to speak Spanish. So even if you take the European qualification across a border, the medical council there can require you to have a language test. And I think that just makes sense.
We have a number of Spanish students studying with us, as we do from every country in Europe, pretty much. And just on that, and also the previous point that was made, we are, I think, the greatest destination for Erasmus. I think we have by far the largest number of students on Erasmus coming to our medical school.
Half of my class is currently Erasmus.
Yeah.
So we're extremely popular. For those that know, they come here for at least a year to do Erasmus with us, as well as other things from all over. There's Erasmus for Europe, and also Erasmus Mundus, which covers a lot of the globe.
Yeah. Someone's asked about student accommodation. There are two aspects of student accommodation. One is the university, the Charles University does have various dorms across the city. That doesn't mean you're going to be next door to the faculty. So do be prepared to travel, because like any civic university in the big city, the accommodation is where they've got the accommodation, and the faculty buildings are where the faculty buildings are. So the university does have dorms, and they are relatively cheap. You're not going to get 5-star luxury for what you're going to pay, let's be honest, but they are going to be cost effective for you to live in a city like Prague. If you're a student who's applying for a visa, you are guaranteed the accommodation, because the accommodation certificate which the university provides is a requirement in order to secure your student visa when you apply for your long stay visa before you get your residence permit.
All foreign students are guaranteed residence in halls if they require it. Okay. Many of them prefer to live in our campus is right smack bang in the centre of the city, the tourist area. It's a hospital campus rather than a university campus. The city is the university campus throughout the whole city. But I remember when I was in my first year, I was never a great morning person, and my halls were a good hour, an hour and a half from the anatomy building, where we had anatomy dissections in that time starting sometimes 7:30 in the morning. So I very quickly decided to move to an apartment which was about 5 minutes walk, right over the river, about 5 minutes walk to the entrance doors of the anatomy department. And it was costing me, I don't know, actually, Taryn, what's it like nowadays for you guys?
It's pretty okay. Recently, it's got a little bit more expensive, but I came from London, so I think rent here is very affordable. You could live on your own in a 1-bed studio for about, I'm sorry, I'm going to talk in pounds, but about £600-700. Yeah. I have friends who live with flatmates. So 2 flatmates in Vishrad, which is like 10 minutes away, is about kind of £300-400 a person. I have 3 flatmates and my rent is under £300, and I am about 4 minutes walk from anatomy.
That includes your utilities, Taryn, or
that's everything.
Okay.
Everything.
Yeah, that's everything.
Like utilities, rent, bills, Wi-Fi.
Yeah.
Everything.
So even though it's a capital city, and Prague is one of the fastest economically growing capital cities there has been in Europe. I think it's got the largest number of startups, actually, because of very good tax rates we've got in the Czech Republic. So although that has driven property prices up, it's still significantly more affordable than most cities in the UK, including cities like Manchester, Liverpool, Sheffield, etc. Yeah, and especially London.
You also have kind of this unofficial student chain. So as 6th years leave, they'll kind of find the 1st and 2nd year to pass their apartment down to. So you get like historically student apartments that kind of end up running like dorms, because everyone that's always lived in the building has always been a student. So more students just move in. So they're not officially dorms, but they essentially function that way. Which is quite nice, because you get
landlords and
good landlords, English-speaking landlords, and also it's nice it's nice to live with flatmates who also know what you're doing, know when you're studying, and there is a big expat community here, and I feel like students form at least 50% of that.
And it's only growing, really. The Czech Republic as a whole, its numbers of expatriates going to the Czech Republic as a very progressive, open country, and ideally located in Central Europe, with amazing universities and amazing public services, has been very popular over the years. And we've had a lot more interest from students from East and West. Hence, we're running the exams in Hong Kong and in New York, as well as in the UK. And we already have applicants for all of those exams. What I'm going to do now, guys, we've been on for about an hour and 15 minutes. I know some people do have to go. So are there any more final questions? Then please pop them in now. Alternatively, you can email us at hello@medicaldoorway.com, or go to medicaldoorway.com and leave an inquiry on the website. We will get back to you. Information on how to do that and how to apply will be in the description at the bottom of this video on YouTube. So please do check out those links and get back to us on that. Unfortunately, I'm not.
So if anybody wants to get in touch with me for like student queries and all, Ben has all of my contact details, and I'm more than happy to be emailed, Facebooked.
Taryn become the Medical Doorway student representative in Prague, and it's been amazing for the students that we're going out there over the last 5 years, because, and especially
I feel like I know all the medical students that have come after me. Like we have a whole Medical Doorway mini community coming through.
We have that many students in Prague. It's becoming a bit of a Medical Doorway centre, not just in the first faculty, I do have to say as well. We've got
second fac as well.
And that's the one thing I know at the beginning of the year, probably not this year, but definitely next year, the 3 faculties in Prague have a multi-faculty social where they get to meet the other members of the other faculties as well. And that is brilliant because they do share some facilities. I know some of the 2nd and 3rd faculty students do come to use some of the facilities at 1st faculty as well. And the Mottel Hospital, where the 2nd faculty is based, is somewhere where many students go because it is an amazing clinical facility with its own underground station, which I found very convenient actually when I'm... Yes. For those students that needed to know, you can get Uber in Prague as well. So it is easy if you are running late to just jump in an Uber and get. But one thing I've noticed is all the trams run on time, all the buses run on time, and on the underground, because the public transport is so cheap, there's no barriers to get on and off. You just walk onto the trains, you walk off the trains. It's a very open and safe country as well. I think it's the 8th safest country in the world under the latest rankings, or 7th safest country.
So 6th this year, I think.
6th this year, okay. So yeah, this is a great thing. I often have to explain to those students in places like Singapore where I do presentations, because Singapore is considered one of the safest parts of the world. And they ask, how safe is this place? And I compare it to Britain, which is something like 47th safest country in the world at the moment. So Czech Republic is considered one of the safest countries in the world, if not the safest country in mainland continental Europe anyway. Okay. There's no more questions at the moment anyway, so I think it's probably the time to say thank you for everyone that's attended to listen to this presentation. Thank you to you if you're listening after this recording on YouTube or on Facebook or on Vimeo. I want to say a huge thank you to Taran Preet, who's taken time out of the 5th year of medical school to help us out again. If you want to check some of our other YouTube videos, you'll see Taran Preet doing our exhibitions at the Royal Society of Medicine, as well as our pre-departure briefings. And that's one thing I'll say.
They're really useful.
Yeah, all the Medical Doorway students do come along to our pre-departure briefing, which is there held in August, usually in London. We do stream it live on our Facebook channel as well for those students who are coming along, who can't come along to it. This current enrollment, we did it online, obviously, but the previous year we had Taran Preet, we had
Atta came
from Pulaski
Dentistry,
yeah, and from Masaryk University as well. We've had representatives from Masaryk University in the past as well. So it's been great to have so much student involvement. And I think it's good for students to see, and aspiring students to see, someone who's actually nearly at the end of that qualification, to know that if you do get your head down, you do study, you do balance your life between study and social life, that you will actually get there and you'll have that career that you aspire to. And not just from a student perspective, from Eitan, from a graduate perspective, and someone who's gone on to be a consultant surgeon in the NHS and in the Czech Republic as well, to see that you can actually, this is a viable and a high quality option for people to take their career forward. So thank you, Taran Preet, and thank you, Eitan. You're horrendously busy dealing with the daily teaching and the surgical, as well as the administrative roles that you have, especially in this current situation. So I want a huge thank you to you for spending this time talking with those students today and offering that time for me. I really do hope that I get the chance to come back out to Prague sometime soon.
Always welcome, Ben. Thank you also.
Hopefully.
If I could say, thank you to you and to Medical Doorway for the having us on your platform. To you listening, I can only recommend Ben and his team, Medical Doorway, with the highest recommendations. He is second to none in how he will help you, how he treats you, the information you can get from him. We have very close relationship in communication, so you're more likely to find out the latest information from Medical Doorway and Ben's team than any other route to be here. And I hope to see you soon, and to meet you all in the exam and interview, and to get you to be one of our family here at LF1 at First Faculty of Medicine in Charles University.
Thanks for that, Eitan. We do work really hard here to help ensure that our students are fully supported and know what the truth about applying and studying medicine really is, because unfortunately there's so much information out there and much of it is so unreliable. It's great to have it straight from the horse's mouth, or behind the surgeon's mask, I'd say, in this particular. Anyway, guys, links down in the description below to the exam dates and the application forms. Everything's going to be there. Until next time, if you have any questions, do get in contact with us. It doesn't matter what the question is. If you ask it, it's been asked tens of times before. But I'm going to sign off and say thank you to everyone, and stay safe, stay healthy, and have a hopefully great end to 2020 as is possible. And let's hope we all turn a corner in 2021. And for many of you listening today, hopefully we'll see you at Charles University First Faculty of Medicine next September. Take care. Bye for now.
Bye.